coaching is about helping people or teams to unlock their potential and activate their ideas and goals and really turn those ideas into action.
Coaching is about you listen, you provide some really sacred space where they can explore and find the answers for themselves. And there's an innate belief in coaching that the person that you're coaching has the inner resources to do it for themselves. And what you do is help them navigate some questions so they get to that answer themselves.
Coaching is around asking somebody, and it's coming from within. So it's the individual unearthing, it's that exploration inwardly for them to enact that. You're not telling them to, the individual is doing it for themselves.
The coach does not direct the coachee to actually do anything. They just offer a space for reflection. Whereas in a mentoring relationship, the mentor brings their experience, they bring their knowledge, and they might make recommendations. They might offer advice. A coach will never indicate a choice that the coachee might make, whereas a mentor might say, in my experience, this is what I found. You might consider some of these options.
Counselling is therapeutic and needs a specialist level of skill to do it. So we don't counsel when we're coaching. And if you feel you're straying into that, then you need to know your own boundaries, and you need the client to know the boundaries as well. And so you do that through contracting.
Other way that you might see coaching in your life is a sort of a more informal coaching or coaching conversations. Maybe a coaching, you might be part of a workplace where the culture itself lends itself to coaching conversations in which people practice asking open-ended questions of each other. And I can, some examples of that might be to say, instead of saying, what should we do to fix this issue? A good coaching question might be something like, what are some of the things we could do to fix this issue? So it's that opening up the thinking, sort of widening the perspective, and helping folks to, again, sort of look through different lenses when they're examining their work. Learning a few really key coaching questions or coaching techniques that are very basic that you can just pull up out of your toolbox at any time can be really, really powerful in a staff meeting, in a huddle.
It's giving people the confidence not to fear it not being the right thing, and what do they do about that? So it's taking the fear away. It's helping people enact and have that growth mindset and thinking, haven't mastered it yet, and having a go. And if it doesn't, well, what do you do about that? Learn from it, and that's how we learn and make things better. So I think coaching is a really powerful tool for all the elements that is needed for innovation within team dynamics.
You learn to turn off judgment. So you learn to sort of stand down the voice inside of you that's telling you what's good or bad or right or wrong, in terms of what you're hearing from the person you're working with. And so it really forces you to become a better listener. And when you become a better listener, you become a better perspective taker.
People learn more when they're in a safe place, and coaching, one of the core tenets of coaching is that you create that safe space for them to work in so that they feel psychologically safe. Professor Michael West talks very eloquently about some work he did over a long period of time, where he was able to prove in acute trusts that when leaders and systems were supported and developed to be high-performing teams with good leadership, that's compassionate, you can actually impact the mortality rates in that team with their patient population. So actually we've got a duty and a responsibility to be self-aware, emotionally competent leaders, and that's what you get through a coaching conversation. But to me, in the NHS, we should all be coaches, all of us, and we should have some element of coaching ability, whether it's a coaching conversation for health, or whether it's to do with, you know, you have a hierarchy of staff above and below you. And I suppose it's utopian, but my vision would be that if we're all trained in that coaching conversation, then you have a coaching system, and then you have a system that's inquisitive and inquires and doesn't see feedback as criticism or a threat. And then they start responding, and that's when lessons are learned, and that's when improvements are made. And I think they probably will be sustained much longer and much better.
We know that you have the potential to make these important changes. You have the potential to give voice to people who might not be at the table. You have the potential to ask hard questions that aren't always popular, but are necessary to make sure that we're improving care. And so by helping people understand how coaching can unlock that inside of you, I firmly believe that people in the system feel like they are more effective, that their work has value, that they are valued as professionals. And so I think that the, you know, wide scale impact of that kind of mindset shift is powerful.